And this is the third vlog about the American Occupational Health Conference 2021. And today I attended 3 sessions, and I'm gonna provide a little overview of those 3. The first sessions were refreshers, reminders on the anatomy, physiology, and pathology of both the shoulder and the spine. So it was pretty much interesting. This presentation was given by Nicholas Sormas, the medical director of Texas Medical Insurance. It provided an interesting link towards some online resources to perform a physical examination. I'm going to put this on the description box below. He started to provide some definitions, and especially what's interesting, the distinction between a strain and a sprain. So a sprain would involve a muscle unit, so there is a contractile element that is impaired when we talk about a strain with a T, and talking about a sprain, it's only the ligament that is impaired, so there is no contractile element involved. I'm not going to review all of his presentation, which was basically a reminder of, as I said, anatomy, a bunch of conditions, including impingement, slap tears, something like slap for superior labral, interior posterior tears of the glenohumeral labrum, which is something that may be work-related traumatically, rotator pathology, and so forth. Same with the spinal examination, back examination, providing some reminders as to how to take reflexes and how to do the physical examination basically. The second session was on social determinants of health, and unfortunately we had some technical issues, so I will report just on the portion that I was able to follow, and hopefully the full session will be on the ACOM website for those who have registered for the conference. So this presentation was given by Kevin Smith, the medical director of ProMedica 360 Health. He provided the CDC definition of social determinants of health as being the conditions in the places where people live, learn, work, and play, affecting a wide range of health outcomes as well as quality of life. He provided an overview of the social determinant of health component of a more global program, US-based, called Healthy People 2030. And within this program, there were 5 key areas of social determinants of health that would allow you understand what are the different topics we would need to address while talking about social determinants of health. Healthcare access and quality, educational access and quality, social and community context, economic stability, neighborhood and built environments, and there is an increased interest in the built environments. 30 to 55% of health outcomes are deemed related one way to another to social determinants of health. The presenter was mentioning something quite interesting on a slide entitled, "Are we asking the right questions?" And it's really interesting and important while dealing with occupational medicine issues. We tend to easily judge our patients and make easy comments on them. And sometimes we need to take a step back and think about why this patient behaves this way. What are the determinants that would explain this behavior that I see, that I'm not liking, that I disagree with, or whatever. So one example would be, for instance, ask about and encourage exercise. We would do this. We would encourage our patient to do exercise, some of them or most of them. This is pretty much something we would discuss in occupational medicine, whether or not it's the purpose of doing occupational medicine. I think it's outside of our core competencies, but still, some do. The thing is that we may ask about exercise, But we may not ask about the determinants, such as safety in the neighborhoods. Like if you live in a very dangerous neighborhood or with no facilities, no safe sidewalks, or no parks close by, it may be much more complicated for patients to do exercise. And this may also be linked to the income and social situation, meaning like the richest, the wealthiest patient may have all of these facilities close by, and all of the less wealthy may struggle to have access to a safe environment to practice physical activity and exercise. This is something to have in mind in occupational medicine. My take on that is, especially when we think about PPE provision. Like it's easy to say, oh, bad worker, you're not wearing the PPE. Well, what is the provision of PPE? Are the supplies sufficient? And also, are there any conflicting advice, any conflicts between the timing required to properly don and doff PPE, having in mind that contamination may be critical during those steps of wearing and removing the PPE that the worker may have. If it takes a lot of time, and in the same time we are putting a lot of time pressure on the worker, at some point it may simply not fit, and the worker will give probably some priority to doing the task rather than protecting themselves. And I'm gonna finish this overview, hopefully shorter than yesterday, with a very, very interesting session provided by Dr. Howard, the director of NIOSH, on vaccination and COVID vaccination currently in the US. So he reminded us that in the US, the vaccination currently authorized are just on an emergency basis. So the authorization is not final. So this will have a lot of impact, a lot of consequences in terms of legal enforcement, and as he discussed later in his presentation, about making COVID vaccination mandatory. He reported the safety of the vaccination, very minimal adverse effects. The fact that is breakthrough with the vaccination is pretty much expected, like no vaccine can be 100% effective. So we would see people having COVID symptoms, having a COVID infection despite being vaccinated. It's pretty much unlikely, but any vaccine would have an efficacy less than 100%. So he's been discussing the variants of concern, and also the fact that some variants, like he explained what variants of concern are. So the variants of concerns have a negative impact on diagnostic, treatment, and vaccine efficacy. They have increased transmissibility and increased disease severity. The thing is that as of today, no variant of high consequence has been identified. So none of the variants identified currently, as of today, has been classified as providing high consequence, high impact on the reduction of the effectiveness and prevention measure. The B117 variant is now predominant in the US, and the Indian variant B1617 has been now found as well in the US. In terms of data on the vaccination, the COVID data tracker showed that almost 250 million doses have been administered. But the thing is that it's the older people that are vaccinated. In terms of age range, the people over 70 years old are the most protected in terms of vaccination. So it leaves us with the wide range of people of working age with not a lot of vaccination here. So in terms of occupational health, this is an issue. Dr. Howard also mentioned the very, very concerning issue of the discrepancy of vaccination rate with regards to ethnicity. So like here, it didn't mention the fact that there are possibly some systemic racism issues in here, but this is something especially now, we would need to have in mind that it's also related to the previous presentation on social determinants of health. So clearly, the white non-Hispanic people are more vaccinated than their proportion in the general population, whereas the Hispanics and Black, so basically all of the BIPOC population, are less vaccinated than they should be. So we do have a very concerning issue here. And final, a very important and interesting discussion as to whether or not it's possible in the US to make the COVID vaccine mandatory. So in a nutshell, from Dr. Howard from the NIOSH, NIOSH is a department of CDC, it's very unlikely that the COVID vaccine may be mandatory, may be enforced for a lot of reasons. First, there are legal texts in the US at the federal level, like reminding that individual liberty is not absolute, and that states can require compulsory vaccination in certain circumstances, mainly for schools and for healthcare facilities. But the thing is that it wouldn't probably be applicable to those vaccines that are authorized just on an emergency basis. So it's pretty much unlikely. Then a question that is quite interesting or important is that would a employer be able to fire a worker refusing the vaccination? Here it's pretty much complicated to say yes, you can fire as an employer your worker that is refusing the COVID vaccine. First, there are exemptions for the COVID vaccination in the US. So two categories of exemptions: the religious belief exemptions and the medical exemptions to it. And then the vaccination and the refusal of vaccination is not canceling the duty to accommodate until undue hardship. So basically, if a worker is refusing the vaccination, then the employer has to accommodate the workplace in a way that the worker is not getting COVID themselves or spreading COVID to the workplace. And with telework or like remote work options, it's pretty much unlikely that the undue hardships in many occupations, in many jobs, would be reached. So in this context, the reference text, I'm not very familiar with the US legal requirements. I'm learning with this conference a lot. So there is a text called the American with Disability Act, and with respects to this text, the ADA, the employers would need to really demonstrate that the employee would represent a direct threat at the workplace. So this may be pretty much complicated. So there have been circumstances where employers have been willing to enforce vaccination in some of the workplaces, but groups of workers in 2 occasions, as of today, have challenged this decision, and it's going at the federal court. There may be some possibility in the future that armed services may be forced, like they may have a mandatory requirement to get the vaccination, but still, probably not until the vaccination or get a final authorization, not the EUA only. The thing is that CDC is encouraging and strongly encourages the vaccination, and the CDC has a toolbox of various communication items that may be used to promote vaccination, but they can't make it mandatory because of all of these legal issues. The final point that has been discussed in this very interesting presentation was vaccination credentials. And in here, Dr. Howard said that he had no hard answer, like it's there are pros and cons in having vaccination credentials. It's definitely not a new question. We have other vaccinations in which there are requirements with providing a proof of vaccination. There is a COVID-19 CDC vaccination card, but all of this may provide some concerns. For instance, there may be concerns in terms of immunity duration. We don't know yet how long the immunity is going to last. So what about your card, your credential being issued today? Is it going to be still valid within 1 year? How we can have a framework for those credentials with so many things unknown, it's pretty much difficult. The second ethical challenge, there is a discrepancy in access to the vaccination. So if we were to put vaccination credentials right now, it's maybe unfair for those willing to get vaccinated but struggling to get the vaccine. And there are currently some fraud and counterfeit credential cards that are circulating, and the FBI has released a warning against those counterfeit vaccination cards. And same in the US, there are pros and cons. Some states are against the vaccination credentials, 18 of them, and 4 states are for a vaccination credential. Some universities are requiring from the upcoming fall term that students would need vaccination credentials to go back in-person training on campus. They would still allow for the religious belief exemptions and the medical exemptions, but still, this is on the pipe for some universities. So all in all, this was these 3 sessions were the ones I attended. I also have screened some posters. There are some interesting on various topics on including indigenous and native workers in Alaska as regards to coal workers lung screening. So yeah, there are a bunch of interesting posters to look into as well. I'm gonna stop here for today, and I'll meet you again tomorrow.